All right, so we're diving into a topic today that I think we're all familiar with, at least on some level, bacterial infections. You've sent in a ton of research on tobramycin, and it seems like you want to make sure you've got all the right info about this antibiotic,
It's great to be here.
which is great. You are in the right place to learn all about it.
Mhm.
It's interesting when you think about it, nearly 14% of deaths around the world are actually linked to bacterial infections. That's huge when you really stop and think about it. I mean, it really shows just how important it is to understand these infections and, especially the medications that we use to treat them. And that is where our expert comes in today. They're
Absolutely.
here to walk us through tobramycin from start to finish. So, like, how it works, what you need to know, the whole 9 yards.
Yeah, happy to break it all down. Tobramycin is really interesting to me because it's so often prescribed for something that I'm sure like almost everyone listening has had to deal with at some point, good old-fashioned eye infections. So it's an aminoglycoside antibiotic, which means it's specifically going after bacteria. And as you know, not all bacteria are created equal.
Oh, absolutely not, right? That's a whole world of different types of bacteria out there. So when we talk about tobramycin, which ones is it? Like, what's it going after?
Right, so we're talking some of the usual suspects here, the ones that tend to cause a lot of these infections. So that would be like Staphylococcus aureus and Streptococcus pneumonia. I'm sure you've heard of at least one of those before.
Right, right. Those are the ones that everyone kind of knows, yeah.
Exactly. But then we've also got Pseudomonas aeruginosa. Now, this one can be a little more, should we say, stubborn?
Stubborn how? Fill me in.
So Pseudomonas aeruginosa, it's kind of notorious for figuring out ways to resist antibiotics. It can be tricky to treat. But the good news is tobramycin is usually still really effective against it, especially when we're talking about the eye drop form.
Okay, so it's like a targeted weapon in that sense. But I'm curious, how does it actually do its thing? Like, does it just go in and like completely wipe out all the bacteria?
That's a great question. And it's actually not quite that simple. This is where I think some people might misunderstand how tobramycin actually works. It's not that it directly kills the bacteria. It's more, I guess you could say, strategic.
Oh, okay, I'm intrigued.
So tobramycin, it actually targets the bacteria's ribosomes, which, if you think about it, are basically these tiny protein factories inside of the bacterial cell. Well, what tobramycin does is it binds to these ribosomes, and by doing that, it prevents the bacteria from multiplying.
Oh, so it's not a direct kill. It's more like it's like cutting off their supplies so they can't like grow and spread.
Exactly, you got it. And this is important for a couple of reasons. First of all, it means that tobramycin relies, at least in part, on your own immune system to kind of finish the job. Your body needs to be able to clear out the bacteria that tobramycin has stopped from replicating. This is different from some other antibiotics that just go in and directly kill the bacteria, which can be harder on your body in some ways. The second thing is it really highlights why understanding the right dosage and using it properly, like it says in the information you sent, is so crucial. You absolutely have to keep that right concentration of tobramycin in there to make sure those bacterial factories stay shut down.
Right. That makes a lot of sense. So it's not instant.
Well, it's not quite like flipping a switch, no. Tobramycin reaches its peak effectiveness after about 1 to 2 hours, so it's in there working pretty quickly.
Oh, wow. That's faster than I would have thought.
Yeah, it gets going right away. But you won't necessarily feel those effects right away.
So there's like a bit of a lag between what's happening like inside, with the cells and when you actually start feeling better.
Exactly.
Okay.
You usually start to notice improvements within 2 to 3 days. Things like less itching, the redness starts going down, that kind of thing. But, and this is important, like can't stress this enough, even if you're feeling better after a couple days, you absolutely have to finish the entire course of treatment. Whatever your doctor told you to take, you got to take the whole thing.
Yeah. I've heard that before, but why is it so important to keep going even if the symptoms seem like they're gone?
It all comes back to that bacterial resistance we were talking about. If you start taking the medication too soon, you might actually be letting the strongest bacteria, the ones that survived that initial round of tobramycin, you're letting them multiply. And guess what? Those are the ones that are more likely to be resistant to the tobramycin in the future, which means it'll be way harder to treat if you get another infection.
It's like you're training them to be stronger.
Pretty much, yeah.
Not what we want. So even though it's tempting to stop as soon as you feel good, it's really like you got to play the long game with your health, right?
100%. Got to finish the course.
Now, we can't talk about any medication without addressing side effects because, they're real.
Yeah.
And our listeners sent in a lot of questions about this. So can you kind of walk us through some of the common side effects that people might experience, especially with the eye drops, since that's what we're focusing on here?
Yeah, absolutely. So the good news is that most of the side effects that you get with Tobramycin eye drops, they're usually pretty mild and they don't last very long. You might feel some like burning or stinging when you put the drops in, which is super common.
Hmm.
Some people also say that their eyes feel red or itchy or like they've got something stuck in there.
Which, I mean, none of those sound fun, but they also don't sound like the end of the world.
Exactly.
Mm.
And most of the time, they get better as your body gets used to the medication. But it's always important to remember everyone's different. Everyone reacts to medications a little
Hmm.
differently. So if you are having side effects that are really bad or just don't go away, you really need to talk to your doctor.
Yeah, better safe than sorry, for sure.
Yeah.
One thing that came up a lot from the listener questions was about tobramycin and whether it's hard on your liver. Is that something that people need to be worried about?
That's a fantastic question. And it just shows how important it is to be informed, really understand the medications that we're putting into our bodies. So with the eye drops specifically, the chances of them impacting your liver are extremely low.
Okay, so that's good news. Why is that, though? Like, what makes the eye drops different in that regard?
It all comes down to how your body absorbs the medication. When you're using eye drops, the medication is mainly absorbed right there in the eye area, locally. Only a tiny, tiny amount actually gets into your bloodstream, which means it's not really reaching your liver in any high enough amount to do anything.
It's not like taking a pill that your whole system has to process.
Exactly, it's very localized. Now, it is worth mentioning that there have been some studies on other forms of tobramycin, like if you get it intravenously, and in some really specific situations, those did show a very, very slight risk of liver complication.
So different ways of taking it, different potential outcomes, right?
Right, exactly. But even with the IV route, those issues are very, very rare. And again, those studies don't really apply to the eye drops because with those, the absorption just isn't the same at all.
Okay, that makes sense. Now, I know we've been talking about how effective tobramycin can be for treating these bacterial eye infections, but it's probably not for everyone, right? Are there certain people who should be careful with it or maybe not use it at all?
Yeah. Are there like red flags, people who should be extra cautious? You're definitely right to ask that it's not for everyone. I mean, first and foremost, anyone who's allergic to tobramycin, that's a no-go, right?
Right, makes sense. Allergies are no joke.
Definitely not.
Ah,
Then you've got infants, especially little ones under 2 months old. You got to be super careful with them.
because their systems are still developing so much at that age.
Exactly. Those tiny humans, their bodies are still figuring everything out. Using strong medications like tobramycin that early on, it can be risky.
Yeah, for sure.
And then, of course, you've got pregnant women and those who are breastfeeding.
Another group where you really got to be cautious with any kind of medication.
Absolutely. And honestly, there isn't a ton of research yet on how tobramycin affects those situations, pregnancy and breastfeeding.
Right.
It's always better to be safe. Talk to your doctor, right? Yeah.
Yeah.
They can help you weigh the pros and cons, figure out if maybe there's a different treatment that would be a better option, that kind of thing.
It seems like no matter what, that open communication with your doctor is just key.
100%. They're on your team. And the more they know, like your medical history, any allergies you have, other medications you're taking, the better they can guide you.
Right. Absolutely. Okay, so let's talk about something that I think we've all been there at some point. What about missed doses? Life happens, you forget. What's the deal with tobramycin?
First of all, don't panic. It happens to literally everyone. With the eye drops, the most important thing is to not double up on the doses. Okay.
Okay, so no trying to play catch up if you miss one.
Exactly. No need to overcompensate. If you realize you missed a dose and it's almost time for your next one, just skip the one you missed and get back on track. Keep it consistent.
Okay, consistency is key. Got it.
Yeah.
Just like you were saying before about, maintaining that level of medication.
Exactly. Now, if you remember the missed dose pretty soon after you were supposed to take it, then yeah, go ahead and take it. But again, never double up. If you're ever unsure about it, just call your doctor or your pharmacist. It's always better to check.
Definitely better to be safe. All right, so to wrap things up, it seems like tobramycin can be a really effective way to tackle these bacterial eye infections. But as with so many things in health, it's all about using it responsibly,
Yeah.
and making sure you're having those conversations with your doctor or pharmacist, right?
Couldn't have said it better myself. Knowing how it works, the good, the bad, and everything in between, that's how you make good decisions about your health.
Absolutely. Well, you have given us so much to think about today when it comes to tobramycin and those pesky bacterial infections. And for everyone listening at home, as you continue to learn about this, here's a final thing to ponder. We've talked a bit about antibiotic resistance. It's a growing concern all over the world. So here's our challenge to you. How can each of us contribute to making sure antibiotics are used responsibly so they actually keep working for us and for generations to come? Something to think about. For now, thanks for joining us for another deep dive, and we'll catch you next time.